Welcome back to the Move Better Project. I'm Dr. Sam Martin and I'm here to help everyday athletes like you solve problems, move better, feel better, and perform better. Today we're going to talk about how to use these voodoo bands, compression bands, whatever you want to call them. They're a really great tool that can help with all different kinds of movement problems and pain that people have. Today I'm going to show you two techniques that can help with almost any kind of knee pain, and you don't need a doctor of physical therapy like me to do it for you. You can do it on your own at home. If you don't have one of these bands, I'll put a link in the description to buy it. Make sure to thumbs up this video if it helps you. Tell me about what kind of knee pain you have down in the comments, and subscribe for more videos like this to help you move better. Let's do it. Alright, so one thing that we always want to do whenever you're doing an intervention is you gotta have a retest to make sure you made a difference. So figure out whatever movement it is for you that triggers the pain or discomfort that you're having in your knee. Let's say that it's a squat for me, and I know that, alright, every time I squat, whenever I get down, oh right there, I feel that on the outside of my knee. Then I know, alright, that's what it feels like before. I can take a picture and then I can go back and do the same thing afterwards and I know whether it's better or it's not. Two techniques today. Number one, we're going to wrap above. Number two, we're going to wrap below. This is a general principle of really any manual therapies. If we have dysfunction or pain at site B here, we want to treat A and C. So we go above and below, or upstream and downstream, however you want to think about that. And a lot of my movement coaching clients have been dealing with things like IT band syndrome, or medial patellar pain, or quad patellar tendonitis. Is just really common overuse injuries that a lot of people who are athletic have, or who just move and work out and try to be healthy. So here is the general principles of the voodoo band. This thing stretches and it can wrap really tight, but we want to overlap by half, and we want to go half as tight as we can. So if this is 100% stretch, I want to go about 50% stretch. Alright, so here we go. Starting just above the kneecap, I'm going to wrap around, and the key is not to let it slip out until you get that first wrap pressed down and secured. Now you're good to go. For my second wrap, I want to capture a little bit, this last little bit of vastus medialis that's still exposed, because if you're having especially medial knee pain, that muscle in that area can be a problem. So I'm going to wrap downward a little bit with number two, and then from there we're just going 50% tension. Again, that's 100%, that's 50. 50% overlap. I'm trying to wrap half of the band onto my last wrap around, and then we go all the way up. And then when you get to the end of the wrap, you got to just keep a finger hold underneath, and then we wrap around and tie it off. Alright, so number one, I just want to get a little bit of basic knee flexion. And I'm just rocking, doing a quadruped on all fours rock. And I don't want to push into any pain. If I get pain here, that means I need to stop a little bit short of that. But I want to move back and forth and get these tissues that are very often really, really stiff to have to slide against that compression. They're all squeezed together and now they have to slide against each other. And that's part of the benefit. Number two, I'm going to work on the other side of the knee and pop up into a little down dog. And I'm just working on terminal extension. So I'm getting my knee all the way straight, capturing the hamstrings and the posterior soft tissues. And I'm doing each of these about 10 times. If I start to feel cold or numb or tingly below the band, or any sharp pains, then the band's got to come off. Alright, number three, I'm going to turn and face here. I want to push this knee out. So I'm working on these medial tissues, adductors, medial quads, groin muscles, to get that knee to go all the way out and reduce some of the tension on the medial knee. And then that's good. After that, the band is going to come off. Boom. And you can see that skin has gone from my normal pasty white to bright pink, because I'm getting a lot of blood flow back into the area. We kind of squeezed all the extracellular fluid and blood flow out of there for a while, and now it comes back and it's nice and warm and it feels really good. Alright, so wrap strategy number two is we're going to go below the And while a lot of the structures that actually cross the knee joint in the front are above, so that one tends to be the most effective, sometimes we can have some stiffness from down below as well that leads to pain and discomfort of the knee. So here's what I'm going to do. I'm going to start down here. I want to get to about the bottom of my gastroc, which is this thicker, meatier part of the calf. And I'm going to wrap in the same way that we did before. I want to get that first loop closed, boom, and then 50% tension and 50% overlap as I come all the way up, and I'm going to stop short of the knee joint itself and the knee cap, the patella. I don't want to be putting pressure onto that with this particular technique. Get all the way up, get that last little bit of calf, and tie it off like that. Make sure you remember where you tied it off. And then a couple different movements here. So first off, I'm just going to get kind of into this deep knee flexion. This is kind of like a squat position. And what I want to do is I'm going to find my fibular head here. So that's this little bone right here. That's the top of the fibula bone. I'm going to put the heel of my hand in front of that, and using a little bit of pressure, I'm going to kind of force that backward as I'm getting deeper into that knee flexion. And that's a movement that is often very stiff that can lead to some lateral knee pain. So especially if you're having some pain on the outside of your knee, you can add that one. Alright, so now I want to work on lengthening some of these structures in front, tibialis anterior muscle and other soft tissues that are there. So I want to get into plantar flexion, pointing my toe, and then end range knee flexion as well. And as I kind of sit onto my heel, I'm getting to end range. And that's pretty stiff for me. I've been doing some running this week, so that can be a little bit intense. If you can handle that and that's easy, you can go even further a little bit and add some very end range terminal plantar flexion by lifting your knee off the ground. The other way is to go back to our old friend down dog, which we did above the knee. And this is really capturing the gastroc here, which crosses the back of the knee joint. And I'm just doing kind of a one-legged down dog, a little bit of terminal knee extension. And all of these, you notice I'm moving back and forth. Just, it's sort of a flossing or kind of sliding through end range. And that's key to the technique. We want to get all the tissues to just move a little bit. Once that's done, we take it off. Boom, 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 boom. Lots of blood flow. My calf's gonna turn that beautiful medium rare shade of pink. And then I just wanna retest my movement that we tried earlier. So for me, that's the squat. And again, maybe I get down and hey, that's a lot better. I know that I can feel different side to side as I'm in that very end range knee flexion. You know, pick a movement for you. It might be something like this that recreates your knee pain or getting back. But again, test, intervention, retest. That's kind of how we know whether this stuff works. Alright, so that's it. Wrap that thing tight, move it around, see if it helps. Make sure to thumbs up this video if that helped with your knee pain. Let me know in the comments what other kinds of things you're dealing with. Subscribe for more videos to help you move better. See you next time.